Here's another Women's Health for Men and Women segment I'm calling Herb Your Enthusiasm. AI Dr. Beeman here, aka OB-GYN Kenobi. The real Dr. Beeman is licensed in obstetrics, addiction medicine, and delivering, see what I did there, uncomfortable truths about the devil's lettuce. Let's talk about something that's becoming more common but still risky, using marijuana during pregnancy. I know you might be thinking it's natural, from the earth, and helps with nausea. You've probably heard someone say, well, my friend used it and her baby's fine. Whether you call it, but let's look at the evidence. Because what's fine in one case doesn't mean it's safe across the board. First, the jazz cabbage crosses the placenta. That means it gets into your baby's bloodstream. And because babies' brains are still forming, THC can act on cannabinoid receptors that are crucial to brain development. So while you're looking for relief, your baby's brain is getting a buzz it didn't ask for. What does the data say? Using wacky to backy in pregnancy is associated with a higher risk of preterm birth, low birth weight, and small for gestational age infants. One major study found an up to 2.6x increased risk of low birth weight for babies whose moms blazed during pregnancy. There's also an increased chance of NICU admission and placental complications like abruption. And later on, we're seeing connections between prenatal cannabis exposure and neurodevelopmental issues, including attention problems, hyperactivity, and externalizing behaviors. Not to mention the increased rates of gestational hypertension and preeclampsia in women who use during pregnancy. A lot of women use marijuana to self-medicate, especially for anxiety, sleep, or nausea. And yes, those are real struggles. But cannabis isn't a medically approved treatment for those issues in pregnancy. In fact, chronic use, pun intended, can cause cannabinoid hyperemesis syndrome, a condition with severe vomiting that ironically makes nausea worse. It's often only relieved by hot showers and stopping cannabis altogether. And when it comes to breastfeeding, THC shows up in breast milk, lingers, and may impact early brain development, even after birth. Both American College of Obstetricians and Gynecologists and the American Academy of Pediatrics recommend avoiding cannabis during pregnancy and breastfeeding. But here's the real message. This isn't about judgment. It's about informed choices. If you're struggling with anxiety, nausea, sleep, or substance use, you deserve support. There are safer, evidence-based options to help. Talk to your OB. Talk to an addiction specialist. Pregnancy is already hard. You shouldn't have to navigate it alone or high. This has been Women's Health for Men and Women. I'm AI Dr. Beeman, reminding you, your baby's brain is worth protecting and your well-being matters too. And remember, it's okay to name your baby Reggie or Mary Jane, but you should do it for the right reasons.
I'm Snoop Double G, and you know it's serious when even I say, don't like that flower while you just dating. Nothing says I love you like a chronic free umbilical cord. Peace, love, and prenatal vitamins.